An annual health check is a key part of helping people with learning disabilities. One of the best ways that we can help is with prevention. And so we check someone's health, see if there's any health issues early on, and help them prevent any complications down the road by doing a top-to-toe assessment. It's really important because it helps us break those barriers that people with learning disabilities often face and are often not seen. And so helping people with learning disabilities by giving them the tools to break these barriers is absolutely essential in helping them take charge of their own healthcare. A health action plan is a great way to make those changes that we discuss in the health check. And it's really useful because it helps support their wellness and allows them to have a look at what they can do for their health and get involved and make those steps to make those changes.
There's a number of things that actually made this a really good annual health check, but four main things come to my mind. The first one is that the doctor who was actually going to be doing the health check called us himself. He explained what the health check's going to be about, how long it will take, what it will entail, and on top of that he even asked us himself whether there's going to be any reasonable adjustments that are needed by her. Whether it's quieter time, she's not as confident on steps, is there something else we can do? So that all made me feel confident at going for the health check itself. The second one was before the health check, we actually received a pre-health questionnaire which I could fill in with my daughter, and that just made it easier for her and myself in terms of what we were going to expect coming to the health check. The third thing, which I think was actually really important, was when we arrived for the health check, he actually spoke to her rather than to me and asking me questions. He asked her questions, and because she's got enough communication skills to understand what he was saying, she could actually answer. She took responsibility for her own health, and his style, his personality, everything really mattered, which meant it was her health check rather than something that I'm just supporting her with. And the fourth thing was, following on from the health check, there was a need for a social prescriber, which meant it was someone who could actually talk to us for Hershey's well-being, which in turn would help her with her health.
Do you know what a health action plan is?
Yes, it is a plan about my health. It is given to me by the doctor after I have had my annual health check.
How does your health action plan support you?
Because it tells me what I need to do to be healthy in small steps. For example, it might tell me I need to do more exercise to keep myself fit. It must also tell me that I need to eat more fruits and vegetables because these foods are good for me. I also like my health plan as it is easy for me to read and understand it. It supports me as it helps me to stay well over the year.
Do you think young people with a learning disability should have an annual health check?
Yes, most definitely. I think it's important for young people to know how to stay healthy with the help of their doctor or nurse.